So some of the factors that contribute to pressure injuries are the physical state of the patient, the different type of medications the patient is on, and from a practical standpoint, what type of mask is being used during non-invasive ventilation, the clinician's education on how to size the mask correctly, how to apply it, in an appropriate manner. In an attempt to help reduce pressure injuries, and some of the factors that may help reduce pressure injuries is, one, staff education. I can't stress enough that staff education is paramount in trying to prevent pressure injuries. All aspect of caregivers, may it be the ordering provider to the bedside clinician, to the technical partner who helps ambulate the patient, etc., need to understand the steps that are necessary to reduce the chance of pressure injuries. It's really important to make sure that the correct mask, the correct size is applied to the patient, and utilizing a device that reduces shear forces. Some type of device that can go on easy and come off easy is also important. All caregivers that participate in the care of the patient have to be equally educated on what their roles are individually and as a collective group. It's also important to provide bedside education to the clinicians on how to size the mask appropriately, how to choose the right mask interface, and how to use the correct settings. Because education cannot just be stagnant either. It has to be ongoing. You have to assess where you are clinically as a team. How are your patients progressing? What are the number of pressure injuries again? And then constantly reassess, is there best practices that we could be doing? Is that a mass choices? You need to have different sizes because you're dealing with a very, a very large patient population and with various face sizes. So you have to have a mask selection that might go from like an extra small to a large.